Good morning, my beautiful Hush babies. Before my next client gets here, I want to do a little story time. So there was a client I worked on about 2 weeks ago. She came in with a severely droopy eyelid. It's called ptosis. She had Botox done elsewhere. About a week later, she noticed her eyelids a lot lower and it continued to get worse. So she reached out and asked if I can help. And sure enough, love helping people. I'm going to share the befores and afters, and then I'm going to hop on and explain what happened. Okay, so in the photo that you saw in the previous slide, you can see in the top one that her eyelid is really low and she's looking straight. In the after photo, it's a lot more open. It's still not where we want it to be, but it's getting there. My biggest issue is how providers will brush off whatever happened. She was told, like, don't worry, it'll go away, don't use anything, it's fine. Can you imagine looking like that for almost up to 3 months? We don't know how long it'll take. Some cases it wears off faster depending on the dose that was used, but still, it's correctable to a certain extent. At least you look normal when you go out. Long story short, she came in, I examined her. We did a few droplets along the eyelid where the eyelid ptosis had happened, and she started using Upneek maybe like 3 or 4 days later. Huge improvement. The Upneek is going to help that eye stay open as well. So I'm going to be re-examining her on Saturday. That's the 2-week mark since I last saw her. And I used Jeuveau to treat it, and I just put maybe, I think it was like 6 or 7 units along her eyelid. And within 2 days, she noticed improvement. She started using the Upneek probably 2 or 3 days later. That will help her more. Long story short, the reason why I'm going off on this rant is because we're providers. Happens. Things can go wrong. Take accountability. Help your client out so they look normal. Can you imagine yourself, if you're an injector, you're a doctor, you're a surgeon, whatever it is, someone does that to you and you go off for 3 months looking like, I don't know, Quasimodo. At the end of the day, I love helping people. If there's an issue, I'll be more than happy to assess it for you if your provider is not taking accountability. So I went off on the rant and I didn't get a chance to explain what could have happened. So again, there's a 1% chance that this can happen to anyone. Most likely, based on her assessment, I think that, I don't know which toxin was used. There's a lot on the market. So most likely they went too deep in the glabellar area, and then the product seeped down into the levator muscle of the eye, and it caused that droop. It's not fun. It doesn't feel comfortable. The treatment itself is not painful when we treat the eyelid, but using the Upneek drops, it can cause a lot of dry eye. Again, it's a temporary thing. It's rare to have long-term side effects. I've actually seen clients that have had long-term side effects, but treat it early. It will help the client. It'll help the person feel better about themselves, and they will not regret getting Botox. Thank you for joining my morning rant.